Hi, my name is Ken, and I wanted to update everyone on what's going on with my surgery. First, I want to thank everyone that has given to my GoFundMe. That money was used to pay for travel expenses, doctor's visits, and tests to try to get me approved for the required surgery. I could not have done it without your assistance. And from the deep inside my heart, I thank you. Late last year, doctors up at the University of Wisconsin Medical Center, Froedtert Hospital, agreed to perform the surgery on me for the lymphedema. At the time, the insurance company wanted nothing to do with it. They would not pay for any of it. And the cost of the surgery that the hospital gave me was far more than I was originally asking for with this GoFundMe. Almost twice what I was originally asking for. After months of negotiation and back and forth with the insurance company agreed to pay for part of the surgery. Around 80%, which is a lot. So I'm glad of that. However, they won't pay for all of it. And they won't pay for the recovery expenses, some of the reconstruction, and they won't pay for travel expenses related to the surgery. Which is why I'm recording this video. The surgery is going to be performed on July 1st, 2025, up at Froedtert Hospital in Milwaukee, which is about, at the time I'm recording this video, about 10 days away. The doctors are going to be removing close to 200 pounds of affected tissue from mid-belly, mid-chest, down into my groin. They will also need to do a lot of reconstruction around, well, my penis and testicles. The surgery is going to be about 6.5 to 7 hours long, and I'm looking at 8 to 12 weeks of recovery. Altogether, from what I understand, they're even going to have about 6 doctors and a bunch of medical students involved performing this surgery, because there's a lot to remove and a lot of sewing. And I apologize. I'm going to have some pauses in this video because there's a lot going through my head. I'm both excited about the surgery and really scared about the surgery. I guess I'm actually more scared about the recovery, because there's a very high chance of complications after the surgery. The bad thing, though, about all this is the insurance won't pay for some of the reconstruction. Oddly enough, they won't pay for reconstructing the belly button. But I'm not concerned about losing the belly button. There's a few other things that I'm a little more concerned about when it comes to the reconstruction, because I kind of need to use them. They also won't pay for most of the expenses involved in recovery, which kind of shocked me. I'm going to need to have a wound care nurse come in. It won't cover it. I'm going to need to get a hospital bed because I have to sit it up for almost a month until they are able to remove the 4 to 6 drains that I have in my body. They won't cover bandages, gloves, anything involved in treating the wound for recovery. Which, it's going to be a lot because we're looking at, 8 to 12 weeks of recovery before the wound heals. It's going to be that large of a wound. They also won't cover travel expenses. I have to go up to Wisconsin. I live in Illinois. And I have to travel all the way up to Wisconsin to Milwaukee the day before the surgery. And I have to stay in a hotel room because I need to get a couple tests done for preparation for the surgery. Mostly blood tests. But I couldn't, as much as I tried, I couldn't get them approved to be done at a hospital down here. So I got to get those done the day before. So now I got to get a hotel room for myself and for my dad who's driving me up there. The surgery's July 1st. It's a holiday week. And it's going to be really expensive. The hotel room for the 2 days, for the day before the surgery and the day of the surgery, so my dad can be there until I come out of recovery after the surgery, is going to be $600 to $700 altogether. Hoping to get that cut a little, but that's not going to be cheap. Additionally, our van isn't working real well, and we may have to rent a vehicle for those 2 days. Again, renting a vehicle just before the 4th of July holiday. It's going to be expensive. I'm sorry. This is really eating me up inside, and this is real hard for me to do. I know that this video may not make any sense at points, but between the emotions related to the surgery and the extreme difficulty it is for me to ask for assistance, I'm having a lot of difficulty recording this video. And as much as I don't want to ask for help, I need to ask for help. I need to raise between $6,000 to $10,000 as soon as possible. The money will be used for 3 things. One is the travel expenses to go up to the hospital. It will also be used for recovery, to cover the cost of the bed and other equipment that I may need for the recovery and supplies that I may need. The third thing it will be used for is to make a good faith payment to the hospital. I got to give them something. they're not really happy when they look at that right now. I don't have an income. And I'm going to owe them $40,000 to $50,000. So I wanted me to give them something. So as much as I really, really hate doing it, I need help. If there's any possibility that any of you can give a little more to the GoFundMe, I really desperately need it. I thank you ahead of time if you can. If you can't, I understand. But I ask you to please, please share the GoFundMe with others. I'm going to try to post an update the day after the surgery and let everyone know how it's gone. I thank you for watching this video. Again, I thank you for those that have helped in the past. And I really thank any of you that can help now with the gift. Thank you for watching this video.